have you all here with us today. And to get us started, we are going to go ahead and introduce Dr. Valmont, our VI Department of Health Deputy Commissioner. Welcome, Dr. Valmont.
Good morning, good morning, good morning. Welcome to our 4th annual Cancer Summit. Let me begin by thanking Senator Carla Joseph for being here, our CEO of both hospitals, Ms. Darlene Bartiste. Let me welcome Dr. Tess Richards from Eastern Medical Center. Of course, our Assistant Commissioner of Health, A.C. Sims, our Commissioner, and the incredible staff of the Department of Health who are here today, along with our VI Cancer Coalition, and to everyone here with us in person, welcome and thank you for your interest in the work that we are doing at the Department of Health Chronic Disease Program. The Chronic Disease Program is a unit within the Health Promotion Disease Prevention. I'm going to pause and recognize the arrival of our chair of the committee, Legislative Committee on Health and Hospitals, Mr. Ray Fonseca. Thank you, always supporting and happy to have you with us. Okay. Yes, again, recognizing all our key partners. The Assistant Commissioner of the Department of Human Services is here as well with us, and you'll get to meet everyone over the course of the day. But I just want to make sure and welcome everyone who's here with us in person and joining us virtually if you are. Thank you for taking the time to be part of the effort to help work on reducing the burden of cancer disease in the territory. Today's theme, One Plan, Shared Action, Stronger Outcomes, is very intentional and exemplifies the commitment of all our partners who have been working together to help develop and support the implementation of the USVI Cancer Control Plan. In 2022, the VI Department of Health Chronic Disease Program successfully responded to a Centers for Disease Control and Prevention Notice of Funding Opportunity for the Comprehensive Cancer Control Program. This program includes 3 components: the Breast and Cervical Cancer Early Detection Program, the Central Cancer Registry, and the Comprehensive Cancer Control Program. As during our 3 prior cancer summits, today you will receive updates on the amazing progress made since we last met and explore opportunities to continue the work to implement the USVI Cancer Plan. The transition from plan implementation to development requires commitment, dedication from a broad cross-section of the community, and the strongest desires to make a difference. I wish to close by recognizing our awesome team at the Chronic Disease Program. Please stand and just wave your hand and be recognized. Dr. Fredericks, everyone. And we could not do this without our VI Cancer Coalition. So Cancer Coalition members have been instrumental in implementing this program. So as I welcome Commissioner of Health, Justa Tita Encarnacion, to share her welcome remarks as we launch the 2026 Cancer Summit. As usual, as before, we are looking to have a wonderful day and a half of engagement, discussion, and guess what? Work. When Dr. Fredericks calls you to a room, there's some work, but we always have fun. So please have fun and enjoy the day. And Commissioner Encarnacion, please. Thank you.
Good morning, everybody. Did you see when Dr. Valmont was actually talking about her team, you see the brightness in her face? So let's give Dr. Valmont and her team and Dr. Linnea Fredericks another round of applause. Thank you, thank you, thank you. Welcome. I know that protocol has been established, and we are also expecting some other senators, but please thank you all for being here. This is really the 4th, but I know that it won't be the last. because of the energy that we all share. So it truly is an honor to welcome each and every one of you to our Cancer Summit. And I say our because I look around this room and I don't see professionals. I see people who have dedicated their lives and in many ways their own personal journeys to ensure that no Virgin Islanders faces cancer alone. And we have our partners that came here as well to help us to do so. And for that, we appreciate each and every one of you for coming within the Virgin Islands to help us. Today is more than a meeting. It is an affirmation or a reaffirmation of our shared commitment to the people of the Virgin Islands. Every person in this room represents an important part of the fight against cancer. Our healthcare providers, lift your hands, healthcare providers, public health professionals, many and all of us, researchers, community organizations, community leaders, advocates, each and every one of us, survivors, caregivers, and partners. Together you have helped shape a vision that belongs to each and every one of us. We are all here because we have answered a calling. Every one of us is here because in one way or another, cancer has touched our lives or the lives of those we serve. That shared purpose sparks the energy that we feel as we sit here, the energy that will increase throughout the day as we walk around and begin to question the plan that we have spent the last 4 years working on and improving annually. As I often said, the USVI Cancer Plan belongs to all of us. It was developed through the collective efforts of individuals who generously shared not only their professional expertise, but in many cases, their personal experiences. Our purpose today is to reflect on the progress we have made, identify opportunities to do even better, strengthen the partnership that make this work possible, and renew our commitment to improving the lives of every Virgin Islander affected by cancer. As we move forward, let us remain focused on 6 guiding goals. Prevent cancer whenever possible through education, healthy lifestyles, and vaccination. Detect cancer early through timely screening and diagnosis. Ensure access to high-quality, patient-centered cancer care. Improve the quality of life for survivors, caregivers, and families. Advance health equity by strengthening partnerships and engaging every community. Build a sustainable cancer control system through data, innovation, workforce development, and shared accountability. We speak about data a lot, right? Because we can't do anything without actually the data being presented. These are more than strategic goals. They are promises to our families, our neighbors, and our future generations that we will continue working together so that fewer people hear the words, "You have cancer." And those who will know they're supported every step of the way. Before we begin today's discussion, I want to offer my deepest gratitude to every organization, every healthcare professional, every volunteer, every survivor, every caregiver who has contributed to this journey. Your dedication reminds us that meaningful progress is never achieved by one person or one agency. It is achieved through partnership, and along and throughout the day, you'll actually see how that works. You know, when we get together within our groups, no matter which area of cancer we're trying to talk about, you're going to actually see the energy arise, and you're going to see the principles of who we are come together. I encourage each and every you to engage openly, share ideas, celebrate our accomplishments, and challenges that makes us think differently. Thinking differently is important. Together we can build a future where prevention is stronger, access to care is greater, disparities are fewer, and even the Virgin Islanders has the opportunity to live a healthier life. Cancer is difficult to talk about, right? I don't think anybody else would disagree with that. That's a fact. But people should leave feeling that progress is possible because of the people gathered in this room. Each one of you will make a difference today. Thank you for the unwavering commitment to this important work. I wish you a productive, inspiring, and impactful Cancer Summit. I wish us a productive day because I will be here with you today as well as tomorrow. It is one plan, a shared action, and stronger outcomes. May God continue to bless each and every one of you and the U.S. Virgin Islands. One team. Thank you so much for being here.
Thank you so much, Commissioner. So now we are going to go ahead and move into hearing some updates. We're going to hear updates on what the work of the USVI Cancer Coalition has been doing during the past year, some data updates, and I wanted to point out on your tables, you have a QR code. This is the USVI Cancer Plan. It is online. It's a 47-page document, and the updates you're going to hear is the work we've been doing as we have been implementing this plan over the past few years. So we're going to go ahead and welcome Dr. Fredericks.
Sorry, I'm not Dr. Fredericks. Sorry. Good morning, everyone, and welcome to our USVI Cancer Summit. My name is Kevisha Watley, and I am the Comp Cancer Program Manager. Before we get started, I wanted to go over a few housekeeping items. So first day of school. So we have on the table, you'll have your blue folder. It's underneath the white box. On the left side of the folder is the agenda for both of the days for the summit. So it looks like this. And on the right side, you'll find the worksheet that we'll be using throughout the sessions. Everybody good? And in your bag, there's a pen, and there are also pens on the table. Okay. If you need to connect to the Wi-Fi, there's a green card on the table with the network name and password. This is important. If you opt out of the media consent form, we kindly ask that you sit closer to the back of the room or the corner, and you're gonna have a dot on the right side of your name tag. Just please have that visible. Lastly, the restroom is on the left side, straight down, men on the left, females on the right. At this time, I would like to introduce Linnea Fredericks, Dr. Fredericks.
All right. As protocol has already been established, good morning, everyone. Good morning, friends, family. That's what we're like at this point. I want to welcome you officially to the 4th Annual Cancer Summit. On behalf of the Department of Health Division of Chronic Disease, I really want to say thank you all for being here. So whether this is your 4th time here with us or your first time, thank you and welcome. Returning participants have helped shape the coalition into what it is today. And thank those of us who are here for the first time, or those of you who are here for the first time. You bring fresh new ideas, and we're very happy to have you. Together, we plan to make this coalition stronger and more sustainable. If you were here with us last year, you probably remember that Mother Nature had different plans. We were scheduled to have a 2-day summit in St. Croix, but we had to condense it to 1 day. That was in September. So we moved our summit outside of the peak hurricane season. That's why we're back here in July. So thankfully, the forecast looks much better, so we're looking forward to having the full day and a half together. As I was preparing my presentation, I found myself thinking, why do we continue to show up year after year? Why do we do this work? Yes, we're here to evaluate our progress, discuss the data, celebrate our accomplishments, and identify our priorities ahead. But for most of us, this work is much more than that. Behind every statistic is a person. Behind every objective in our cancer plan is a family hoping for better outcomes. And for many of us in this room, cancer isn't just something we work on. It's something that we've lived. And that is certainly true for me. During the first summit, I had shared with you, for my personal fight in this battle is that I had lost my 4 grandparents to cancer. Now today, I add my father is also battling cancer. So while I stand before you as the chronic disease director, I also stand as a daughter, a granddaughter, and someone whose family has been deeply affected by this disease. Like so many of you, I don't do this work simply because it's my job. I do it because I know what's at stake. That's why today's summit matters. Our theme this year, which you've heard, and I'll reiterate, one plan, shared action, stronger outcomes. That couldn't be more fitting because it reflects exactly what we've been building over the last 3.5 years. Anyone can host an event once. Anyone can gather people in a room, have a few presentations, and call it success. But this is our 4th Cancer Summit. 4 years of showing up, 4 years of bringing healthcare providers, community organizations, government agencies, survivors, caregivers, advocates, researchers, and community members together. 4 years of building relationships that extend far beyond this room. Consistency matters because meaningful change doesn't happen in one single meeting. It happens through sustained partnerships, shared accountability, and people who continue showing up, even when the work is difficult. As you heard, we applied for a CDC grant in 2022, and that's why this summit has been able to happen for the past 4 years. And the name of the official program is the National Comprehensive Cancer Control Program. When we applied, that was the first time in history that the Virgin Islands received this funding. And that funding created an incredible opportunity, not simply just to support another program, but to build a coordinated approach to cancer control across the territory. One of the program's core requirements was to establish and maintain a comprehensive multi-sectoral cancer coalition. So rather than building something entirely new, we intended to reach out to those people, those advocates, those organizations who are already doing that type of work. And we reached out to they had an existing USVI Cancer Coalition, which was founded by some of the grassroots organizations, YAG Foundation, Cancer Support VI, and they're in this room. We have representatives, you'll hear from them later, American Cancer Society, Ribbons for a Cure, and the St. John Cancer Fund, and they graciously allowed us to merge our funding opportunity, and we became one coalition. Together, we created one shared purpose. I also want to recognize our coalition chairperson, co-chairs, Denise and Kevisha. I really want to thank you both for your leadership and unwavering commitment to this coalition. Over the coming months, we will continue to strengthen our coalition by formalizing our leadership structure and operational guidelines to ensure long-term sustainability and continued impact. Since receiving the award, the CDC award, we've convened stakeholders across the territory through regular coalition meetings. So we have quarterly meetings, and then we have an annual in-person summit. And this is how we've continued our engagement and collaboration. Most importantly, though, we did develop the Cancer Control Plan, which was previously mentioned, and we did that in 2024. So the work that has been happening has been towards the implementation of the Cancer Control Plan. It's more than a document, it's our roadmap for reducing the burden of cancer in the U.S. Virgin Islands. But we all know just having a plan sitting on a shelf, that doesn't change lives. People do. So you guys are really important, and I'm really happy that you're here so that you can do the work. So I think somebody said when Dr. Fredericks invites you to a meeting, is to work. Yes. So to bring the plan to life, we decided to establish 4 working groups, and they are prevention, and I want to recognize the leaders of these working groups. I'll ask them to stand. We have Carrie Moulin, who is leading the prevention work group. Monique and Cheryl, they're co-leading the early detection work group. Sandra is leading the diagnosis and treatment work group. And Isa, too, who leads the quality of life and survivorship work group. So leading a work group is no small task. It requires bringing people together from different organizations with different perspectives, different priorities, and then inspiring them to work together on one shared vision. So I really want to thank those ladies for their hard work, although I know they were voluntold, but they've been doing a really great job, so I wanted to publicly recognize them. I also want to thank every member of the coalition who has attended the meetings, volunteered their time, and contributed ideas, participated in our events, or who have supported this work in any way. Your contribution, whether large or small, it is appreciated and it does not go unnoticed. So one of the things that motivates me about our coalition is that we listen. Last year at the summit, we had a Four Corners exercise where we asked you all to provide feedback and input on how we can strengthen the coalition. And you guys suggested that you wanted a little more structure and organization. That is how the operational guidelines came about, which Denise will be presenting on a little bit more. So throughout the rest of this session, you'll hear from our coalition leaders who I recognize. They will give updates on the work they've been doing since last September when we met in person. You guys will also have breakout sessions where you'll go into your work groups and plan for the upcoming year. We've made some good progress, but our work is far from finished. Some of our work groups are thriving, others are still finding their footing, and that's completely normal for a growing coalition. But it also means that we need you around the table. So if you are here and you're not currently in one of our work groups, I'd like to personally invite you to join one. Whether you're a healthcare provider, policymaker, public health leader, we even have UVI students who is the future of public health. Hopefully, they are here. We encourage you to join one of our work groups and show up and assist in any way possible. I also want you all to challenge us, ask the hard questions. Please engage over the next day and a half with us and help us to identify opportunities that we have not yet considered. Because implementing the cancer plan is not just the responsibility of the Department of Health. The plan belongs to all of us. As we continue through this summit, I hope you leave feeling inspired by what we have accomplished, encouraged by what is possible, and motivated to play an active role in what comes next. My hope is that fewer children will have to say they've lost a parent to cancer, and fewer families will have to experience the heartbreak that this disease brings. And more Virgin Islanders will become survivors rather than statistics. That's the future we're working toward. And this is why this coalition and everyone in this room matters. Thank you, and I look forward to a productive, collaborative, and inspiring summit.
Thank you, Dr. Fredericks. So I realized I didn't formally introduce myself, so I will do so now. I'm Denise Molfolleda with I'm the Puerto Rico and U.S. Virgin Islands liaison with American Cancer Society. I've actually been working with the U.S. Virgin Islands for over 10 years. And I do live in Florida, but I get to visit a few times a year and get to work with many of you on a monthly basis in our work groups. So it's always nice to come together and be able to see you and give you hugs and get to have that personal time. So hopefully throughout the day I'll get to meet each and every one of you. So as Dr. Fredericks mentioned, we established, even though the Cancer Coalition started in 2022, we established guidelines in February of this year, operating guidelines. And so part of those guidelines include some leadership positions, just to bring some structure to the coalition. And so some of us have been serving in those positions for the past year or so. And so now I'm going to go ahead and present a little overview. So the leadership positions are comprised of a chairperson, a co-chair, a program manager, the priority work group leaders, and 2 additional representatives. So, and they are to be elected to serve for a 2-year term. And so today we're just going to do a brief overview of those roles, who is currently serving in roles, and there are roles also that are going to be open for nomination. Okay? Let's see if I get this right. It's not working, or maybe I'm pushing the wrong button. Okay, thank you. Next slide. So we're going to start with the chairperson role, which is basically presides over the quarterly meetings that Dr. Fredericks mentioned, ensure that the coalition and leadership decisions are carried out, lead the preparation work for the agenda, promote collaboration amongst the group, ensure compliance of operating guidelines, etc. I'm not going to read the whole entire slide, but then the co-chair, in the absence of the chairperson, then they go ahead and serve in that role. They assist the chairperson in all the efforts mentioned in the previous slide, and after a 2-year term, then they go ahead and move into the chairperson role. We also have a program manager, and the program manager is the one that sends out all the notices for the meetings, keeps the minutes, keeps the membership roster, record of attendance, and that sort of thing, and carries out other tasks. Then we have the 4 work group leads. They preside, they're work group chairs. They preside over their meetings. They lead that preparation work of their agenda. They keep the minutes, keep the membership roster, record of attendance, and really, as Dr. Fredericks mentions, brings that cohesiveness to their work groups. And now we're also going to have 2 members by accumulation, and they are to assist all of the positions that we just mentioned and carry out other tasks. So I call them like our special projects team. Okay, now we're going to go ahead and present who is serving in these roles. So as Dr. Fredericks mentioned, Kavisha and I have been serving as co-chairs for some time now, but now with the operating guidelines, the co-chair moves into the chairperson role. Kavisha is going to stay assuming her program manager role, but in the meantime, she is also going to serve in an interim role as the co-chair. The work group leaders are the ones that were just introduced. Carrie Molan, she's also the breakfast program manager. Monique Warner, she is also the breast and cervical health program manager. Sandra Charles is the territorial cancer registrar for the cancer registry. And Isa Jen is the breast and cervical cancer program data manager. So we're all wearing various hats, but we're very happy that they're doing a really nice job chairing these work groups. And so now we're going to have a nomination process, and that's going to be coming up for a co-chair and for those 2 additional representatives. So that's going to be coming up here, and then we have a Cancer Coalition meeting in the fall, and we're going to go ahead and vote on those members, so that way we can complete our leadership group. We are also going to have opportunities to co-lead work groups. I noticed the detection work group already has a co-lead, but if you're interested in co-leading with prevention, with diagnosis and treatment, and with survivorship, we would really love it if, our community members and those here can step into those roles and help out our work group leads. And if you're interested in serving in any of these roles, you could self-nominate, you can nominate somebody else, and you could email Kavisha, and that will help us to get this nomination process going. Okay? Wonderful. So that's the end of my presentation. And now we are going to be hearing from our work group leads. We're going to hear some updates. So I believe we are starting with prevention with Carrie.
Good morning, everyone. So as Denise already mentioned, my name is Carrie Moline, and I am both the program manager in chronic disease for the behavioral risk factor surveillance system, but I am also the prevention work group leader at this time. So the prevention work group is all about preventing cancer, right? So we prevent cancer through things like diet and exercise, physical activity, and we also prevent cancer through immunization. And so immunization has been the main thing that we've been working on in this last year. For immunization, we encourage people to increase uptake of the human papillomavirus vaccine, or the HPV vaccine, and also the hepatitis B vaccine, and we've been doing so through a campaign called the Stop Cancer Before It Starts campaign. Here, part of the Stop Cancer Before It Starts campaign was a media campaign which used both commercials and radio advertisements. These ads were focused on all people who may benefit from these immunizations. So that includes even people starting from the age of 9 through early adulthood for the HPV vaccine, and also infants from the first 24 hours of birth for the hepatitis B vaccine, but also adults who do not always get the vaccine as children. So we did both web and video ads, and they ran from fall 2025 to summer 2026, so they are not running anymore, but they were very widely heard, and they were all for all different ages. We also did one on the cost of cancer, encouraging people to think about the fact that cancer has a real financial cost, and that cost can really put you back quite a bit in life, and so we wanted to focus on that as well. We also had posters and handouts. We worked with a lot of different medical facilities around the territory to distribute these handouts to their patients. These were in both English and Spanish, and the handouts basically told people to consider getting the HPV vaccine, and also to encourage their different parents in their life to encourage their children to get it as well. Here are some pictures of some of our posters. We had a lot of them, so I don't have them all here. But they are supposed to look kind of like magazine covers, and they have people of all ages on them. We also want to encourage both men and women to get the HPV vaccine, because a lot of the time people think that only their girls need it, but it can also protect cancers in boys and men too. The other thing that we did was we focused a little bit on nutrition and physical activity. This is something we did within the chronic disease program. We did a 6-week workshop this spring. It was called the Eat Healthy, Be Active Community Workshop, and we worked with about 12 people. They were people from the community who just came in for about 2 hours for 6 weeks in a row. And we just worked with them on setting some goals related to their diet and lifestyle. They learned a little bit more about healthy eating, on a budget, grocery shopping, physical activity, strength training, and weight loss. It was a very goal-focused and group-focused activity, so a lot of the time people would kind of tell each other some things that they did. They would talk about their goals. They would talk about some of their struggles. And it gave people an opportunity to talk more about some of the issues that they've had around trying to eat better and be more physically active. And it just allowed everyone an opportunity to learn more. So this program was very well received. All the evaluations we've done so far have given it very good progress. We had a few people who lost some weight from it, and a few people who met other health-related goals that they had set for themselves throughout the program. And we are going to do it again sometime, hopefully this fall. But the program was very popular among the people who were involved in it, and we do believe that it is helping people so far to really know that they're capable of meeting their own goals. And so what's next is we are going to focus a little bit more on hepatitis B. The hepatitis B vaccine is one that we are trying to continue to encourage people getting for their children, especially their infants, as it can protect against liver diseases, including liver cancer. Right here you can see the posters that we're having made right now. They are almost complete, but they are trying to encourage people of all ages to get the hepatitis B vaccine if they have not already. And we also have one to encourage mothers and their infants. Additionally, we would like to do a recurrence of the Eat Healthy, Be Active community workshops, and we would also like to work a little bit more with the schools in order to encourage healthy eating, physical activity, and also immunization within the schools. Thank you very much.
All right, next we'll have Monique Warner, who leads the early detection work group.
Good morning, everyone. I'm Monique Warner. I'm the program manager for the Virgin Islands Breast and Cervical Health Program. And this is Michelle Rolindo, and she is a community health worker. And it have been my pleasure to serve as the program manager, as I said, for the Breast and Cervical Program, and also the leader of the USVI Correlation Early Detection Work Group. And today I will be sharing with you some of the accomplishments over the past year. Our work group is committed to increasing awareness, improving access to cancer screening, and strengthening partnership throughout the territory. Because the early detection doesn't just find cancer sooner, it saves lives, improve outcomes, and give families hope. Over the past year, our focus has been on educating healthcare providers in the community, promoting breast cancer, cervical, and prostate cancer screening, and supporting initiatives that helps connect individuals to life-saving preventative services. Today, I'll highlight our priorities, the progress we've made, and what's ahead as we continue working together to reduce the burden of cancer in the U.S. Virgin Islands. Next slide, please. Okay. This year, the Early Detection Work Group made significant progress in promoting cancer screening and early detection across the territory. We visit physician offices to introduce and educate providers about the Virgin Islands Breast and Cervical Health Program. These visits had strengthened the partnership and encouraged referrals for eligible patients. We have also worked to increase awareness among We have worked in increasing awareness among men by encouraging healthcare providers to discuss practice cancer screening during routine visits. In addition, from April 1st to June 29th, we conducted a 3-month breast and cervical cancer awareness campaign. Through the community outreach, educational materials, public awareness activities, we reached residents throughout the territory with information about the importance of regular cancer screening and early detection. Next slide, please.
Looking ahead, the Early Detection Work Group will continue building on these efforts. We plan to expand our outreach to healthcare providers and community organizations to increase participation in breast, cervical, and prostate cancer screening programs. Our next major initiative is the annual Breast and Prostate Cancer Awareness event, which will take place in October on both St. Thomas and St. John. This event will bring together healthcare providers, community partners, cancer survivors, and residents to promote education, increase awareness, and connect individuals with available screening resources. We remain committed to working collaboratively to improve access to cancer screening and to encourage early detection throughout the U.S. Virgin Islands. Thank you.
Okay. As I mentioned earlier, I am the Breast and Cervical Cancer Program Manager, and the clinic has only been running on the island of St. Thomas. However, we have seen a few patients over in St. Croix, but that goes by a case-to-case basis. So the patients on St. Croix only, they can call the clinic and we can give them more information about being seen on St. Croix. Oh, great. Thank you. Okay, thank you so much.
I'm so sorry. No, what I was saying is that the CEO was actually having the same conversation, not that she was interrupting you.
Yes.
I can do that. But having the brief conversation that she'd like to see it on Syncor as well, and I would agree with that, right? So I asked her, well, maybe we can have one of your team members join your program so that we can actually have, because then that's more energy to actually get it done. And she said yes. So you now have another member.
Thank you.
Thank you, Monique and Lindo. Next, we'll have Sandra, who is going to be presenting on behalf of the Diagnosis and Treatment Work Group.
A pleasant good morning to everyone. My name is Sandra St. Charles, and I am one of the territorial cancer registrars for the Virgin Islands Department of Health Central Cancer Registry. In addition to this role, I also have the privilege of serving as a workgroup leader for the Diagnosis and Treatment Workgroup. Today, I will be providing you with an overview of the Diagnosis and Treatment Workgroup's strategic priorities over the past year, the progress achieved to date, and the next steps. Kavisha. I'm sorry, they're pulling up the slides for me. Okay, I'll just go ahead and continue while they're looking for it. Okay, so our focus and priorities over the past year, priority one was to focus on supporting CKCI in securing funding for the acquisition of a PET scanner and digital mammography machine. Priority two, support CKCI with hiring medical oncology, radiation oncology, and oncology nurses. Priority three, assist CKCI in establishing discounted pricing with hotels and airlines for all cancer patients with the assistance of the USVI Cancer Coalition. Okay, our progress thus far, progress on priority one. The Cancer Coalition and YAG Foundation has written proposals and attended meetings with donors to assist CKCI with the purchasing of a PET scanner and digital mammography machine. So the work group actively pursued private funding opportunities by developing grant proposals, engaging prospective donors, and maintain ongoing follow-up to advance funding efforts. Progress on priority two, which was, okay, so Snyder Regional Medical Center and CKCI has taken the lead on this strategy of hiring medical oncology, radiation oncology, oncology nurses, and continues to recruit staff as needed. Priority three, the Cancer Coalition and Cancer Support VI has developed and submitted a funding proposal to a private donor and have began working closely with the prospective donor to secure and support this initiative. As part of these efforts, Cancer Support VI has taken the lead in developing a pilot project which is designed to provide financial assistance for airfare, lodging, and ground transportation for cancer patients who must travel for treatment. Pending donor approval, we are optimistic that the funding will be received. Cancer Support VI will serve as the project's fiduciary agency. In this role, CSVI will oversee the responsible management and distribution of grant funds, ensuring that eligible patients receive financial assistance for approved travel-related expenses, including airfare, hotel, accommodations, and ground transportation. Okay, let's take a dive into the pilot project. So the pilot project is inclusive of the patient's journey and what's being built. Over the past year, the Diagnosis and Treatment Work Group has focused on developing a coordinated solution to addressing one of the territory's most significant barriers to cancer care, which is off-island travel for diagnosis and treatment. Cancer Support VI serves as the program's patient navigation and fiduciary partner, guiding patients to the resources they need while ensuring that all funds are managed with accountability, transparency, and integrity. Through ongoing collaboration, the work group has built a network of partners, including airlines, hotels, and ground transportation providers, to support patients, particularly those from St. Croix, who must travel off-island to access cancer diagnosis and treatment. The pilot project is designed to support the entire patient journey, not just logistics of transportation. Once a patient is identified as eligible, Cancer Support VI and CKCI will coordinate a seamless step-by-step pathway from airport arrival and ground transportation to hotel check-in and beyond. CSVI will provide patient navigation, guidance, and emotional support at every stage of the journey. Our goal is simple: to ensure that no patient has to navigate the challenges of off-island cancer care alone or face uncertainty about what comes next. Our work does not end here. We will continue collaborating with our partners and pursuing every available avenue to ensure that every patient traveling to CKCI for treatment has access to the care, resources, and support they deserve. The program is in its final approval stage, and we look forward to sharing more details as soon as the process is complete. What's next? The Diagnosis and Treatment Work Group future priorities are to expand the off-island patient assistance pilot program, strengthen patient navigation and care coordination, support continued growth of the Charlotte Kimmel Cancer Institute, expand financial assistance resources for patients, and strengthen partnerships for healthcare providers and community organizations. Before I conclude, I would like to extend a special thank you to all of the Diagnosis and Treatment Work Group members that worked diligently throughout the year to complete the strategies and tasks of this action plan. Again, thank you for your continued support, commitment, and collaboration, because without you, we would not have been able to accomplish all that we did. We are powerful in numbers, and we will continue to work diligently to improve the quality of life of all Virgin Islanders. If anyone has any questions, please feel free to contact me at sandra.charles@doh.vi.gov. Thank you.
I can't go that low. So lastly, we're going to have Quality of Life Survivorship Work Group, who is led by Isa Tujen.
Good morning, everyone. Again, my name is Isatu Jeng, or Isa, for those who are having any difficulty pronouncing my name. And I am here representing the Survivorship Work Group. I also work for the Department of Health Chronic Disease Division as the data manager, working alongside Ms. Monique Warner for the Breast and Cervical Cancer Program. I am here representing the fourth goal of the cancer plan,
which is also the last stage of the cancer journey, and here to discuss some of our priorities and focus areas over the last 1 year since we last met in September. Our first priority this past year has been to, of course, assure quality palliative care, survivorship, and end-of-life care. Secondly, we're trying to promote and provide education, access to resources and support that helps enhance the survivorship journey and life for survivors, and also to identify resources, support opportunities, and increase access to resources for survivors going along this journey. We're also here to educate and increase awareness of things such as advanced planning and advanced care directives and things, documents which help in the process of end-of-life care. So one of our goals this past year has been to share a lot of knowledge with the community, with individuals, and everyone and anyone related to cancer. So we've been able to manage to do that with spreading information on survivorship care plans. For instance, most of those plans are available online, but they're also available in provider offices such as oncology offices. Dr. Del Giaco's office, for instance, has a survivorship care plan where you can list information in that plan on what your cancer journey has been, on your diagnosis, any recommendations for treatment. That way anyone can pick up that plan, whether it's your doctor, whether it's your caregiver, and they can review it and be able to guide you along the process and in the journey. And as we build upon some of last year's successes, we've continued to update the Cancer Resource Guide, which helps provide access to local resources within the territory. It provides information on all the member organizations of the Cancer Coalition. We also have information for nationwide resources that is available online. I'm sure when Ms. Denise Mulfayeda presents, she may be able to share some of that information on some of the nationwide resources that are available. In addition, we've tried really hard to work on, outreaches and different events across the territory. Most recently, the Department of Health led the Health and Wellness Fair throughout the territory. We were able to provide education, raise awareness on cancer to community members, yes, let's clap for that. So that was really successful, and it was held for 3 weeks on 3 different islands. So we definitely, a big kudos to Dr. Ty Hunt Caesar and her team for helping to organize that. Other outreach opportunities and events held throughout the territory include last month's event held by, last month's event for celebrating the 25th anniversary of Relay for Life. That was an American Cancer Society event. And prior to that, the YAG Foundation led the Breast and Prostate Conference, which was held at University of the Virgin Islands, and that was very successful as well. And lastly, the YAG Foundation, the Cancer Support VI held a soiree, their annual soiree, and it was held on St. Croix this year. It was really successful. They were able to raise lots of funds, and those funds go toward cancer patients who actually need that support to either go off island or cover their care and treatment across the territory. And a lot of the work that we have been doing is just to simply help disseminate information throughout the territory, give people access to information and education. We do so through the coalition website, through our member websites, even through, we have Ms. Miranda Wood here who offers oncology yoga services. And we utilize all of these opportunities to help spread the message, to raise awareness, and just simply educate the community on how to get support when it comes to walking through their cancer journey. One thing that we actually achieved last year, was toward the end of last year, and I see Dr. Richards here, was we held our first annual workshop that provided information to providers, to staff, on advanced directives, on the importance of advanced planning. It offered information on palliative care as well as hospice care. And these are areas that sometimes can be vague, and we don't often have enough information on it. But it was led by, unfortunately today, Miss Tracy Sanders is unable to be in attendance. However, she leads Continuum Care, and she was able to lead some of these discussions. So the hope and the goal is that in the future, we'll have additional workshops that can provide people with information on what advanced planning looks like. And lastly, this year, we've just recently come up with a Young Caregivers campaign. And what I very much appreciate about this campaign is that it's given us an opportunity to highlight a small group, maybe marginalized community of young people who also provide care to their family members, to their friends, whether it's a mom, a dad, an aunt, an uncle. They're not often recognized, but they're there putting in the work, putting in the time, and offering that assistance that is needed. We're hoping that in the near future, we're able to print that Young Caregivers booklet. I want to thank Director Lett, who was very much instrumental in helping bring this all together. She received our vision and was able to put it together in this beautiful booklet for us. I do have a sample flyer of the booklet on the back table, but once we have this printed, we're going to be able to disseminate it and also have it available online so that you can just simply click a link and view the booklet. It does offer very insightful information regarding what a caregiver actually is, what steps it takes to become a caregiver. It discusses advanced planning, why advanced directives are important. It discusses all the support and resource services that are available to people and things that young people may not necessarily consider or think about. So it's almost as a one-stop shop for everyone to be able to access information. And going ahead, looking forward, we're hoping to create an expanded advanced directive. The ultimate goal is to have an advanced directive for the territory. Currently, we are working with Juan F. Louis and Schneider Regional to be able to create that advanced directive. It is created, they just want to expand it and also focus on some areas that are ignored, including amputation, what to do for amputations and dialysis and such services like that. There's also currently legislation that is underway with Senator Francis's office dealing with advanced directives, and we have some of the hospital staff, in fact, some providers and physicians that are assisting with moving that legislation forward. We're hoping, like I mentioned earlier, to have additional advanced care planning workshops throughout the territory. So if your division, your department, or agency is interested in learning more about that process, please definitely reach out to us, and we'd be happy to attempt to schedule a session and discuss it with you all. We also actually have, with the help of CEO Baptiste, are hoping to have a designated area once the Charlotte Kimmel Center opens, a designated area where we can have support services related to cancer. Thankfully, members of the Cancer Coalition, including Ms. Barb Michaud and American Cancer Society, Denise Mulfoyeda, have worked effortlessly to assist with that endeavor. So that will definitely be beneficial to community members and those there affected by cancer. There are also meetings being held with patients and families on hospice care, what is available to them on palliative care. The hope is to expand that discussion to also the St. John community because that area is sometimes ignored, so we want to make sure that people on St. John also have access to these same resources. At the moment, I don't see Dr. Michael here yet. Okay, oh great. We're planning a collaborative effort with a grant that she has for Carib Cares. It is a UVI and University of Puerto Rico partnership where they're working with survivors and tracking them and seeing what services are needed. We're hoping to assist with recruitment efforts, so if there are family members, friends of yours who are diagnosed with cancer and would like to be part of the recruitment efforts, please let us know so that we can pass their information along as well. And the goal of that, or the hope, is for them to actually share their stories, let us know where they need support, what we can do to assist, and that way that information can be brought to our work groups and we can go ahead and move forward from there. And the last part of what we hope to do is to continue building on partnerships. So each person in this room is a member of this coalition, and we'd love you all to just be able to be a part of our regular meetings, to join our cause, and just continue building a wonderful collaborative effort going forward. So if you are very much interested in joining, feel free. We have monthly meetings on the third Wednesday of the month at 1 p.m., and feel free to email me. There's my email there, and I'd be happy to get in touch or provide more information. Thank you so much.
Thank you, Isa. All right, so before we close off this part, do anyone have any questions for the work group leaders? Yes, Senator Carla Joseph.
Good. Thank you so kindly. I just want to say, oh, stand. Okay, I feel like I'm in legislative session. Thank you so much for all the work that every one of you do in this room. I really appreciate it, and we as policy makers need a lot of this information. We're making decisions. It's very critical when we make decisions regarding the budget and even rezoning. So I do have a question, because there has to be some kind of data, you get gathering data, and I noted that you have Ms. Sandra Charles, and you are part of that whole data collection. Is there any way that you are plotting, once you have collected the data, where persons, cancer survivors, a person diagnosed with cancer is living? And I'll tell you why. As a policymaker, we come in contact with rezonings. We come in contact with lease agreements for different structures that may be adversely impacting the health of our people. So if we know or have data that we could rely on to make decisions and say, okay, maybe this tower doesn't need to go here because we have some level of evidence that it is adversely impacting the health of our people, that it will be so incredibly helpful, because we are balancing health and economic development. And it's a very thin line when you're doing that. So I wanted to ask that question of Ms. Sandra Charles, or even the work group, if you do plot that out.
I can start, but I'll let Sandra help me out, since this is what she do day to day. So to answer your question, we do collect information once it's available. So remember, at the cancer registry, we get information from the healthcare providers. So if physical address is passed on to us, we have it. But that information oftentimes is not available to us, unfortunately. So I'll let Sandra expound on if she has anything else to add.
Good morning again. The only thing I have to add to what Director Frederick said is that we do have interstate exchange agreements with all of the 50 states. So when patients from the Virgin Islands leave and go to the mainland to receive treatment or care, if they do give them the Virgin Islands address, we are able to get that information and input it into the registry. If they do not, then the information is lost. So that's why we do stress in the cancer registry, if you're going to go away for treatment or receive care, please give them the Virgin Islands address so that we'll be able to track you and track the information. Thank you.
You responding to this? You just had a question? Oh, okay, a different question.
Good morning, everyone. This question is more so an indirect one for the diagnosis and treatment group. So I think I worry a lot about our levels of provider burnout in the territory. I know, most of the oncologists, Dr. Bashan and his wife, forgive me, I forgot her last name. She's a pediatric oncologist, and also Dr. Del Jacko, they're taking care of so many members on island throughout the territory with cancer, and many of them have hospital privileges as well, so they're also dealing, in the hospital and also in their private practice. Are we tracking or are we looking in the diagnosis group about that level of indirect impact? So that's the first one. And then the last comment is, especially to our two senators in the room, definitely please continue to support the efforts for a health information exchange, because this will help with the data and linking off-island providers. Thank you.
Hi, good morning, everyone. I'm Ty Hunt Caesar. I am the Chief Medical Officer for the Department of Health, and I'm a member of the work group. So as a provider in the work group, I don't see the other providers who are on the work group here, which are some of the providers that you actually referenced. So I can tell you that recruitment and retention is a big theme and problem that we are constantly always working on. But as a provider who is a public health physician, I can tell you that the amount of patients that we provide care for is not the reason that provides the burnout. I can tell you that as a physician, what provides the most concern and worry and sort of wear and tear on our souls are the limited resources. So what I would say to that is that we do have these providers who are vested in the community. They are not yet at retirement age. They are here to stay, but what we need to do is try to ensure that we provide the resources and the tools that provide all the standards of care, because that is what actually causes the frustration and the actual desire not to provide the care in the territory. When we don't have the tools to provide the standards, which are dictated by guidelines and recommendations and evidence-based research, then it really provides, or it presents ethical and moral dilemmas, okay? When you have to choose how you are supposed to provide care to certain individuals when it's not standard across everyone, that is what actually causes burnout, if we want to talk about it, mental burnout, and the desire for people to actually leave. It's not the amount of patients and the amount of people that we have to serve, because we do what we can, and we fit people in, and just as long as we have the support staff, the ancillary staff to help and assist, nurses are vital and extremely important and critical to the care that we provide as physicians. So without nurses, we can't provide the support. I can't go and hang an IV bag with chemotherapy as much as I can order it. Well, I'm not a oncologist, but as a provider, we order these things, but we can't do it without the other support of all the other healthcare providers and team members that are necessary. So that comes with human resources as well as the resources that are necessary, that should be available in the territory. Assistant Commissioner Dorset, you sit over Medicaid. So medical assistance is extremely, extremely important in providing the resources, the chemotherapy medications, access to care for many of the services. So when we have challenges and difficulties, it delays care and it provides a lot of worry. I had a patient that had an infectious disease, oncological infectious disease, that I had a young person that I had to work with in consultation with Dr. Bachan. And it took several weeks, and when he finally got his care, because we were waiting on medical assistance to provide that support, it was a relief. But I can tell you that I had many nights that I was sleepless and worried about this young man, to make sure that he didn't end up in the hospital with another with increased morbidity and mortality risk. So that from a provider, that's what I can share with you. That is the concept of burnout with the providers in the territory. We just need the help and the support.
Morning. My question is to any one of the four speakers. Every speaker emphasized collaboration, so if you could remove one systemic barrier, not funding, but one policy, process, or cultural barrier that would dramatically improve cancer outcomes in the Virgin Islands, what would it be and why?
You guys always tell me about, I hear it from y'all, so this is the time to say it.
Well, one thing in the prevention work group that we work on is food and nutrition and physical activity. So those are some major risk factors for cancers, and a lot of cancers we know would be improved or you are less likely to have if you have access to better nutrition and physical activity. And here in the U.S. Virgin Islands, we have some serious barriers to that. You know, as you know, a lot of our food is imported, and food can be very expensive for a lot of people, especially fresh fruits and vegetables. So we know that a lot of people, they want to eat healthy, they want to do better, but they just can't afford to, or they don't have access to, or because of power situations, they feel like they can't do things like keeping their food in the fridge even edible for more than a few days with reliable power. So that is a big issue that we've had, and something we've heard a lot at some of our events, like such as our workshops and also our outreach events. We hear a lot of people who have a lot of issues with not being able to afford healthy food, and so definitely improving the food environment would be something I think would be a big factor in improving our situation here for cancer, because we know that one of the biggest issues for a lot of people is access. And the same is really true with physical activity. A lot of the time people, they want to know how to be more physically active, but it is very difficult for a lot of people to become more physically active because it is something that requires a lot of time and motivation, and that not everybody has. But there are a lot of barriers here as well, which is that we don't live in a walkable community. And we do live somewhere where there are not a lot of streets that have sidewalks, so that is a big issue for a lot of us.
Thank you, and thank you for the engagement, but we have to move on since we're a little behind on our agenda. Oh, sorry.
Well, good morning to everyone. Mine is actually long-winded, so we can go to another section, and then I'll give my comments later, but mine is long-winded. Thank you.
Go ahead.
Okay, well, first of all, well, actually, we do. Darlene, tune into Legit TV July 22nd. So I got my notes here. Let me so my vision is, first of all, good morning, Commissioner, Senator Carla Joseph, the Rules Chair. One of our bills for Commissioner Huster Encarnacion that we got help from Munifa Stout just cleared the Rules Committee for the immunization. And congratulations. And of course, Darlene Baptiste, I'm sorry. She was my boss when she was the Commissioner of Health, and so I always know her as Carty, but it's Baptiste, so my apologies. So she will be before the committee, and my vision is for the Charlotte Kinnaman Cancer Center to be financially stable, equipped with world-class technology, staffed with highly qualified professionals, and accessible to every Virgin Islander regardless of financial status. So I've been working with Barbara on the cancer plan. I've attended a few of these meetings, and I know the statistics for females. Breast cancer is #1 and colon is #2. For males, it's the prostate and colon is #2. So that means colon cancer is the most deadly cancer, and we know about approximately 400 Virgin Islands. So financial sustainability, that's very important. And so Darlene Baptiste is going to be presenting the annual operating budget. We want to know what the projected revenues are. Will the revenues cover the annual operating expenses? We know that's a no. But, you know, I was hearing about 4-point-something million, something like that, but we'll know when you come before us. But we know that's an issue. The other one, the state-of-the-art diagnostic equipment. I know we are going to have a CT simulator and a linear accelerator. I think they install and they're being testing, so that's good. But I want to make sure we have the PET CT scanner sometime, and of course the modern laboratory, pathology laboratory. And then of course there's a whole list of positions. I know that current doctors in the hospital can do it, but we want to make sure that you get the medical oncologist, the radiation oncologist, surgical oncologist. I know we have a doctor that can do that, but I want to make sure the nutritionists, social workers, that is fully staffed. And of course, I want to make sure that every Virgin Islander, regardless of financial or insurance status, have access to the cancer center. So those are some of the things that I want to concentrate on. Of course, our Cigna contract, it's about $220 million. A little bit more than $40 million was spent last year off-island on cancer treatment, and only about 30 locally. So if you add it all up, maybe we can bring some of that back home. That would help defray the costs. But of our total costs, about 33% goes to cancer treatment. So cancer is a very, very serious illness. Of course, we want to make sure that the Medicaid program, Medicaid is an additional $126 million. I know the reimbursement rates, et cetera, are low. That's, going to involve the Medicaid state plan. So I'm going to be very brief today, and I'd like to thank you for this opportunity, and I'll sit here and enjoy all of the good information. Thank you. Blessings, everybody.
All right, the star of the show, AC Sims.
Boy, one thing about this team, that impromptu get up and do it. Good morning. How's everyone doing? I am Nicole the Great. It is a pleasure to be here with you today. All right, I'm going to ask everyone to please stand. Yes, let's stand on up. Nice. How many of you remember Father Abraham? Da 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 da. Okay, sing along. Father Abraham had many sons, and many sons have Father Abraham, and I am one of them, and so are you. So let's just praise the Lord. Right hand. Great, we're going to stop there. That means you can follow instructions. All right, I'm going to ask everyone to close their eyes. Go ahead and close those eyes. Okay. When I count to 3, you're going to open your eyes. But these are the instructions, okay? When you open your eyes, the first person that you make eye contact with across from where you are, you're going to go to that person, okay? When you get to that person, the first thing you're going to do is compliment them on something. It could be their hair, their clothes, their nails, their shoes, their tie. Offer them a compliment. Second, you're going to get their name, their organization, and one way off thing about them, something you would never guess about them in a million years. Okay? We ready? 1 Mississippi, 2 Mississippi, 3 Mississippi, open and go. Let's go, walk over to them. Start with that fabulous compliment. You're getting a name, an organization, and a way off thing. All right, and I'm going to count down from 10. And at 1, you can go back to your seats. And 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you, everybody. You can make your way back to your seats. You can make your way back to your seats. Thank you so much. Thank you, thank you. So we're going to close this icebreaker a little bit before lunch for a small prize. I'm going to tell you what your prizes are. If you can do what we asked just before lunch, one of you, or actually maybe 2 of you, will be walking away with $50,000 in cash. It's right here in my bag. So please, okay, take my icebreaker seriously. We don't pray. Because you see the gifts on the table, you know that I have the 100,000. Is it 100,000? Ah, see? See? You're going to win that money. Okay, thank you, everyone.
Thank you, AC Sims. That was great. All right, so lastly, we are going to have Sandra Charles present the Cancer Registry Data Update.
Good morning again, everyone. I am presenting on behalf of my colleague Veronica Rivera Lopez, who was unable to attend the summit this year. Okay. Next slide, please. Okay, this slide is repeated in every presentation that we give. However, it is important to know that the Virgin Islands Central Cancer Registry was established under Act number 7939 of 2016. Under this law, healthcare providers and facilities are required to report eligible cancer cases diagnosed among Virgin Islands residents. The registry collects information on all reportable malignant neoplasms, with the exception of basal cell and squamous cell skin cancers, as well as benign tumors of the central nervous system. The information that we collect include demographic information, stage of diagnosis, and first course of treatment. The registry is funded through the CDC's National Program of Cancer Registries. Our operations follow CDC and NPCR standards for cancer surveillance, data quality, confidentiality, and reporting. We recently entered year 5 of our current cooperative agreement to continue building and strengthening cancer surveillance in the territory. Although this is the final year of the current funding cycle, our work to improve completeness and data quality continues every day. Registry data can help identify what cancers affect our population most frequently, where screening efforts should be focused, and how healthcare resources should be allocated. Information also supports research, public health planning, grant applications, and evaluation of cancer prevention programs. Next slide, please. Reliable mid-year population estimates for the VI are currently unavailable. Consequently, the VICCR is unable to calculate valid cancer incident rates at this time. Therefore, the statistics presented here represent case counts, and I repeat, they represent case counts rather than incident rates, and are intended to describe the distribution of reportable cancers within the territory. These data should not be interpreted as incidence rates, nor used for rate-based comparisons with other jurisdictions or reporting protocols. Next slide, please. As of July 10, 2026, the registry contains 2,910 reportable cancers diagnosed among Virgin Islands residents between 2016 and 2023. Approximately 53% occurred among males and 47% are among females. Prostate cancer remains the leading cause among men, the leading cancer among men, while breast cancer is the most frequently diagnosed cancer among women. The highest number of diagnoses occurred among adults between 65 and 74 years of age. These numbers provide a snapshot of the current database and will continue to increase as additional cases are identified and reported. The 5 most frequently reported primary cancer sites account for approximately 2/3 of all reportable cancers currently contained in the registry. Prostate cancer is the leading diagnosis, followed by breast cancer, colorectal cancer, and hematopoietic malignancies, which includes leukemias, lymphomas, myeloma, related hematopoietic malignancies, and lung cancer. These findings reinforce the importance of screening, early detection, and healthy lifestyle interventions aimed at reducing cancer risk. This table summarizes the current distribution of reportable cancer cases by sex, race, and ethnicity. The majority of cancers have been diagnosed among Black residents, reflecting the demographic composition of the territory. The registry continues to monitor these patterns to better understand disparities and to support equitable cancer prevention and control initiatives. Next slide, please. This table highlights the 3 most frequently diagnosed cancers among females by age group. Breast cancer remains the leading diagnosis across nearly every adult age group. As expected, the number of diagnoses increases with age, emphasizing the importance of routine screening and early detection. Among males, prostate cancer is the predominant diagnosis beginning in middle age and becomes increasingly common among older adults. Colorectal cancer and hematopoietic malignancies are also important contributors to the cancer burden. Again, these findings demonstrate the value of age-appropriate screening and timely diagnosis. This slide provides additional detail regarding the distribution of cancer cases currently contained within the registry by year. So here's the information for years 2016 and 2017. So in 2016, the total New cancer cases was 538. In St. Thomas, there were 250 newly diagnosed cancer cases, St. John 27, St. Croix 261. And the chart to the bottom is broken down by the top three for male, which is prostate, colorectal, and hematopoietic, and female, breast, uterine, and colorectal. In 2017, the total number of new cases, cancer cases, were 392. St. Thomas 182, St. John 15, St. Croix 195, and this is also broken down by year for males, prostate, colorectal, and hematopoietic as the top three, and the top three for females, breast, colorectal, and hematopoietic. On this slide, here's the information for years 2022 and 2023. These last images illustrates one of the most important concepts I'd like everyone to remember today. Cancer surveillance is an ongoing process. The number of cases within each diagnosis year continues to increase as hospitals, physicians, pathology laboratories, and interstate data exchange partners submit additional information. These numbers should therefore be viewed as the current contents of the registry, not as final counts. The completeness of our database depends on timely reporting of all healthcare providers throughout the territory. Next slide. If you or your organization needs VI cancer data upon request, we are providing a brief report of the most recent data available in the VI CCR cancer database. If you are requesting information, please send an email to veronica.rivera@doh.vi.gov, and we will be more than happy to provide you with that information. Unfortunately, the registry has faced several significant challenges. Cybersecurity incidents affecting both territorial hospitals prevented us from remotely accessing medical records for an extended period, delaying case abstraction and quality assurance activities. At the same time, incomplete physician reporting continues to be our greatest obstacle to achieving a complete cancer database. Together, these factors have delayed our ability to fully capture the cancer burden within the territory. On a positive note, we regained access to both hospitals in March 2026, thanks to CEO Baptiste. Thank you, CEO Baptiste. Next slide. Although these challenges have been significant, we have continued implementing strategies to improve reporting. These efforts include monthly reporting reminders distributed to VI EquiCare, participation in physician meetings, and regular outreach to physician offices. We remain committed to working collaboratively with our healthcare partners to improve reporting completeness and strengthen cancer surveillance. Thank you for your partnership, your commitment to public health, and your dedication to improving cancer surveillance in the U.S. Virgin Islands. Thank you.
Thank you, Sandra. I love to hear data, and you just make it so interesting and so very something that we're all really interested in. So thank you so much. So now we're going to enter the access to cancer care in the U.S. Virgin Islands portion of our agenda, and we are going to start out with Dr. Lillian Santos. She is the Executive Vice President for American Cancer Society, Inc., and the CEO for American Cancer Society of Puerto Rico, Inc., and she's going to talk to us about access to care throughout the cancer journey.
Good morning, everyone. Before I start, I just want to congratulate you. All the work groups really are coming together. They're having a shared action, and we're seeing the outcomes. And it's important, all the initiative information we have, but also it's important to how we're going to access all the great things that we're doing. So answering the question that you brought before, I hope I could answer it during my presentation. So it's a privilege to be here with you today. Once more, I've been in 3 out of the 4 summits, so I've seen the progress, and definitely every cancer patient deserves more than an excellent treatment. They deserve the opportunity to receive it in a timely manner. That is what access to care is all about. Because access to care is much more than health care. It's about making sure every person has a fair opportunity to receive the care that could save their lives. Today, as we reflect on what this means throughout the entire cancer journey, we have to go back to the moment that somebody hears you have cancer. We know that everything changes, and every step matters. So when we talk about prevention, I love what you're doing in terms of the campaign that says stop cancer before it starts. And definitely, if you invest and allocate resources in the prevention and early detection, it's more cost effective. And the earlier you detect a cancer, better for their survivorship rates and the costs involved in treatment. So prevention, early detection, diagnosis, treatment, survivorship, and when necessary, compassionate end-of-life care. Every one of these moments is an opportunity to improve outcomes, but only if patients can actually access the care they need. In U.S. Virgin Islands, and I want to share some of the experiences, is probably the same in Puerto Rico. Transportation to treatment is one of the barriers. Lodging for patients and caregivers. Shortage of oncology and other medical specialists. Insurance coverage and financial barriers. These are not simply inconveniences. They often determine whether treatment begins, whether treatment is continued, and sometimes whether a patient survives. I want to share a story as an example that often we think about a patient, they're ready to go, they're very motivated, who has fully committed to receiving their treatment, but has no reliable transportation. How do they get to their cancer center several times a week? The physicians are there, the treatment was available, everything was ready, but access was not. This experience reminds us that access to care is not simply about health care. It's not simply about hospitals or physicians or medical technology. It's about making sure patients can actually receive it, the care that has the potential to save their lives. So every barrier we remove gives someone a better chance to live. I want to share also one experience that we are managing in Puerto Rico in regards to the shortage of medical workforce. The statistic says that by 2030, 50% of our specialists will be retiring. So recognizing this challenge, Puerto Rico government has begun implementing some tax incentives to encourage young physicians to return after completing their specialty training. So this is for our government officials here. Is this a complete solution? No, but it demonstrates what becomes possible when government, healthcare organizations, academic institutions, and nonprofit partners come together. Perhaps similar collaborative strategies could also benefit the U.S. Virgin Islands. So a question for all of us. As we move toward our breakout sessions in the afternoon, I'd like to leave you with one question. How can we continue? We have heard a lot of the things today, but how could we continue to remove barriers so every person, regardless of where they live, has timely access to quality of care throughout the entire cancer journey? At the American Cancer Society, we believe that where a person lives should not determine where they live, if they live. So that belief is the foundation of us as our mission as a coalition. It reminds us that our responsibility extends beyond hospitals and clinics. It includes transportation, lodging, financial support, advocacy, education, and every service that helps patients receive their care they deserve. On a personal note, for more than 30 years, I've been leading the organization in the American Cancer Society in Puerto Rico. And I have the privilege of witnessing the extraordinary difference that access to care makes in the lives of patients, not only the patient, their families, and at the community as a whole for the people that don't have access to a screening. Those experiences have reinforced one simple truth. Every barrier we remove gives someone a better chance to live. So let us continue removing the barriers, building relationships and partnerships, and creating solutions so that every patient has equitable access to care, every family has hope, every community receives the support they deserve. Because access to care is not a healthcare issue, it's a matter of equity, it's a matter of dignity and hope. Together, let us ensure that where a person lives, again, that their zip code doesn't determine if they live. Together, let us fulfill the promise that no one faces cancer alone. Thank you.
Thank you, Dr. Santos. And now we are going to hear an update from CEO Baptiste on the Charlotte Kimmelman Cancer Institute. And Miss Angela Warner.
A pleasant good morning to all. Yes, I brought back up. I'm just really excited to be here. On a personal note, this is like a full circle moment for me. Most persons, Janice, would know my start in the Department of Health in 1995. I was brought aboard as the project coordinator for the breast and cervical cancer program. And circling back and seeing what it has developed to today, it is because you care. When we first started off the program, we couldn't even say the word cancer. It was all called the Big C. And how over the years we've gone from capacity building into planning, into implementation, is because each one of us care just enough to help those persons who couldn't face it by themselves to get us to this point. And again, I applaud every one of you for your time and your dedication to this very moment. Because you're here, we can actually fight the good fight. So we are here to give you a brief update on the Charlotte Kimmelman Cancer Center. While there may be opportunities for us to speak in a public forum on the record with the senators in very lengthy invitation next week, Wednesday at 10 o'clock, you will be there, Senator? Amen. So we just give you a snapshot, and not just hear from leadership, but actually hear from those persons who have literally their pulse on the day-to-day activities. Since coming aboard as the CEO for the Schneider Regional Medical Center, we've been really tasked with crafting out the timeline overall for the Charlotte Kimmelman Cancer Institute. So we have a soft date with a hard deadline to do the ceremony no later than by November. So that is our time frame that we're working with. The team is putting that together. But in between there, we do have some challenges that we need to address and some policies and procedures that we need to put in place. So again, without any further ado, I'll let these two champions know their names. You could write them down, take your pens, and know their names. This is the future of our Charlotte Kimmelman Cancer Institute. And let's start off with Angela and then Dr. Dormosi. Introduce yourself. Again, we just want to thank them for joining us, and they come with a wealth of information and expertise, and we look forward to them being greater contributors to the coalition.
Thank you, CEO Baptiste, and thank you to all the senior leadership, and thank you for having us here today. Good morning, and I've been enjoying the conference and all the collaborative discussion and engagement. My name is Angela Warner. I am the administrator for the Charlotte Kimerman Cancer Institute, affectionately known as CKCI. And we are excited as we are continue to progress on the facility for its operational readiness. You know, the Cancer Center's opening with ribbon cutting later this year, as CEO Baptiste mentioned. And we understand and we hear the community in reference to the needs and the challenges in which the hurricanes shut down the facility for us to be able to provide the critical cancer services and support services needed in one location. This does not stop our efforts to be able to move forward to get to the stage where we can do that ribbon cutting and bring the patients home. We want to provide competent, compassionate, and just caregiving for all of the patients, caregivers, and their families. I do want to let you all know that the construction is nearly completed.
98%. 98%. Yes.
The machines have been installed, and they are in progress in stages of acquiring the equipment so that we are able to do the commissioning, so that we can say that they are technically ready for the state to serve the community. The next phase is outfitting the interior of the facility with full minor equipment, furniture, and associated packaging. So that is our next phase that we are currently underway. All stages are underway, even in reference to the readiness for staffing. We have brought on our illustrious Dr. Warner, our radiation oncologist. We are in the process. Oh my gosh, I'm so sorry. Dr. Dunmore, radiation oncologist. And we have our medical oncologists who we are working with contractually. We have brought on technical expertise that will be handling treatment planning for the patients. And we are working towards bringing forth our billing staff, registration staff, and we have had countless and just support all throughout, working with our community organizations, CSVI, YAG Breast Care Foundation, the Department of Health, and we are working on making that plan for readiness to move things forward. So I will now turn it over to Dr. Dunmore, our radiation oncologist, to speak. Thank you so much, everyone.
Hi, good morning. My name is Jacqueline Dunmore Griffith, and I am a radiation oncologist who has been hired by CKCI or the hospital to provide services. I've practiced radiation. I know I don't look like it, but I've practiced for over 30 years, okay? So I have lots of experience, and I'm just really excited to be a part of this program. I've had a home here in the Virgin Islands for the past 3 or 4 years, so part-time between here and Maryland. So I am a faculty member at Howard University College of Medicine, and I work in the cancer center there and in the radiation oncology department there too. So I'm looking forward to forging a relationship between Snyder Regional Medical Center and Howard University as well. Over the past 30 years, I've had the opportunity to work in different facilities, and I can tell you that this is a state-of-the-art, okay? You all will have all of the bells and whistles. We will be able to provide top-notch care to the patients in the Virgin Islands. So again, I'm very excited about the possibilities of what we can do. I'm really excited to be here today and hear about your intentions in terms of cancer care throughout the Virgin Islands. So I look forward to working with you all as part of your team. Thank you.
Thank you, Dr. Dunmore. Thank you, Angela. Dr. Warner. So hopefully that gives you a very good snapshot of what we're presenting to the legislative body next week, Wednesday. We're going to go into greater details concerning our budget, the staffing model that we're going to use. We're really going to try to present something that's really realistic for sustainability. And I think that's really important for us at this particular juncture. So again, we look forward to your support as we provide this information, and we look forward to your partnership as we stop cancer before it starts. Blessings to you all.
Thank you so much for the update. I did get a chance to visit earlier this year, and it is a beautiful facility. Can't wait till it opens. So now we are going to hear from Dr. Noreen Michaels. She is going to give us an update on a study that she's doing with the University of the Virgin Islands. Dr. Michael?
Thank you, and good morning, everyone. I was given 5 minutes, so I'm going to put my timer on so I don't go over time. And what, all my people are laughing at me, but that's okay, that's okay. I am really thrilled to be here this morning because we have the privilege of working with the University of Puerto Rico's Comprehensive Cancer Center and their Medical Sciences campus through a sub-award as part of a P20 grant from the National Institutes of Health, where we're looking at the cancer continuum and extreme weather events. We are on the verge of completing year 2 of a 3-year engagement. So what I want to do in the time that I have remaining is to share with you that we are in the throes of a quantitative research study where the focus is on cancer survivors who are in treatment or have been in treatment in the last 12 months. We have been going to different facilities, and I'm really asking for your support, hoping to get some support through the Cancer Coalition. We've gone to Relay for Life on both St. Croix and St. Thomas to try to do some recruitment. And if you're a provider and you know these individuals, if you have family members, colleagues, please encourage them. I have some material here where you can get a QR code and to be a part of this. We will also have a qualitative portion of that study where we'll be speaking with providers and others who support these individuals. So, some of you in here will get calls to participate, so I will say that to you. We're also doing, from the standpoint of community engagement, we're also doing some listening sessions. We're hoping to schedule some with some of the work groups that are participating as part of the Cancer Coalition for the territory, but we're also going to faith-based organizations. We're going to different housing communities to try to speak with individuals there who provide support for cancer survivors who are cancer survivors themselves, as well as other community-based organizations. As part of the work we're doing, we're also trying to we will be using some of the results of the study to identify types of educational materials that would be useful for our residents as well as those in Puerto Rico. We have developed one toolkit. We're working on another one with a focus on just looking at mental health considerations for individuals with cancer diagnoses. So if you want to be a part of that, we have invited someone from the Behavioral Health Unit who's working with us on that. We're trying to get some individuals who are really do work in terms of outfacing to help us, okay, I have 1 minute left, to help us craft messages in a way that will reach the range of individuals we have in the community. We don't want to have materials that are too academic. We want to reach individuals who just got through high school. Some of them maybe didn't finish, but they need the information. So we need the support of our experts in outreach to be able to do that. In the time I have left, I want to invite any of you who is available. Year one, we did our first annual meeting in Puerto Rico. The meeting is going to be here, so I'm delighted to invite you. August 6th and 7th at the Innovation Center. I did stop at 4 minutes and 45 seconds, so I really have 15 seconds left. Just to tell you about the annual meeting, and if you need more information, please let me know. Would be happy to answer any questions you have. Again, thank you for the opportunity.
Thank you, Dr. Michael. So now a few of our local cancer organizations are going to provide brief updates as well. I am going to kind of breeze through a little bit through my presentation, and I'm going to be handing out during lunch a little overview that's going to have some QR codes and things that you could take with you. And I will also say that we are making ourselves available to give a presentation to staff. So I know that you all are going to hear what we do now, but it's the more we get that out into the community, then the more we're able to ensure that everybody knows about the resources that are available. So the first slide I just wanted to mention, which you are going to receive, is just an overview of the programs and services that we provide. Our number one program, of course, is financial assistance, and we've spoken about that quite a bit. Barb and I are on speed dial. We refer patients to each other and to other resources as well. And so we know that the Cancer Center is going to open later. We have a pilot program for transportation and lodging. And so we're going to continue to support those programs as well. So that financial assistance program is not going away. It's just going to continue to be a complement to that, to what's going to be instituted later this year. Yes, Commissioner?
It's always amazing because you think everybody's doing work, but it's always amazing to see how much work is actually being done. So thank you so much for being able to provide this information to all of us. You mentioned educating staff, and something that just came to my mind is we need to figure out a way how we actually get into the community and do the talk in the community. And so looking at housing areas that you can actually speak with, and because that's where the fear comes in, because one of the barriers that we spoke about, Carrie, what are the barriers, and what you said was so true. Sometimes barriers are just a fear of knowing, fear of asking, and fear of hearing. But if you take it to them, and so I think that from an outreach standpoint, I'm sure other people would be willing to work with us to be able to to be able to be a part of what we can do outside and to really take it to them. I think that's going to make a big difference, because teaching the staff, because we have an opportunity to hear it, is the individuals who are not connected with us.
And I think that's a great point. I think we need to take a look back at where we started, even though it may not be readily available. I made some notes. There was the HUD program and the housing grant that allowed us with the Department of Human Services through the Senior Citizen Employment Project. We hired 21 of them to go into the housing developments and create, it's called Circle of Friends. So they were able to go into those particular developments, housing developments, and talk one-on-one and create that bonding in reference to the discussion. So we use men of prominence. I think we had, I don't know if folks remember Mr. Benjamin and Mr. George. Those were two most prominent men within the American Cancer Society prostate group, and allowing them to go into the fire station and went to the police station. And then we have, God rest his soul, Mr. Jackson from the post office. He allowed us to go into, on a Saturday, so we took over the entire parking lot of the post office downtown and allow us to do that. So to your point, going into the community was the way that was most effective. It was funded by those 2 grants, and of course, government had the breast, cervical cancer, colorectal, lung, which they did fund to the Department of Health, which is no longer funded. So dropping that hint right there.
So we need to bring it back. But I have to tell you, good news is that our Region 2 from Health, Hospital, and Human Service, HHS, we met with them actually just this past week. No, it was actually this week. And we met with them, and we're speaking to HUD as well. And so we're back at the table speaking to them. So we will invite both hospitals as well as human services to the table, because we're discussing what do we do next was the conversation. And so that actually opens up a venue as to what we can do. So you can put that on the checklist.
For sure. Thank you so much. And that's why we're here, let you know what we all do, and we will be more than happy to continue to share this in the community. Speaking of education and outreach, we have been in touch with Ms. Warner, and we are going to be supplying educational materials to the Cancer Center for prevention, detection, treatment, and also partnering and bringing additional assistance to help with the navigation of the patient journey. So that is something that that we will be doing, and through all of your partnerships, we just continue to disseminate more information and bring these programs to the community. Moving on, my favorite website is this one, cancer.findhelp.com, because it is a referral service. It is a nationwide referral service. And I always say, how many of you have gone on Google looking for assistance, and you find a beautiful website that says, I can help you pay for XYZ, and then you're like, wait, is this for real? Or is this somebody that just set up this beautiful website, they want to scam me? Well, we have this resource available with vetted nationwide organizations. We have populated it with the local organizations as well. And what I like about it is those that travel off island can put in their local zip code, and they could find out what resources are available to them locally. But those that stay here can also put in your zip code, and this over 900 programs is a zip code from the U.S. Virgin Islands. So you have over 900 nationwide programs available to you. So I really like to promote that. It's in different categories between food and housing and money and education and work and all that. So that is also going to be here in the back of the flyer that I'm going to distribute. Of course, who doesn't have a cell phone? Everybody does. We have an app, which is on the next slide. And that app, you can register and get curated, personalized content to you, your cancer journey. You could connect with one of our 24/7 cancer specialists. And you can even connect and have a support group, connect with a locally trained volunteer that has gone through a similar cancer journey as you. And you could also sign up to volunteer through that app. The next program is ACS Lion, which stands for Leadership in Oncology Navigation. And this is a program that the American Cancer Society has made available, which is standardized training and credentialing program that helps navigators deliver essential support to individuals, caregivers, and families. It meets the Center for Medicare and Medicaid Services training requirements, and is aligned to professional oncology navigation. And guess what? It is free. It is free. So feel free to scan. I don't have that QR code on this one pager. Feel free to scan, get more information, and learn a little bit more about it. Speaking of of lodging, so this is the Puerto Rico Hope Lodge. It's a 4-story building. We have over 30 of these throughout the nation. And patients that are in treatment could stay there at no charge to them and a caregiver throughout the length of their treatment. And we have been able to now connect through the Diagnosis and Treatment Work Group and Barb and Sandra and just the group has come together. The director has actually spoken to us and spoken about how we can support lodging programs here and kind of educated us on the needs of the cancer patient. And something interesting that he said at one of our meetings, it's like a cancer patient could stay at a hotel, but they might be looking at others that are on vacation and having fun, and they are just feeling terrible, and they don't even want to leave their room. And so how can we, once we have the Cancer Center up and running and the pilot program up and running, how can we try to bring other lodging solutions for the cancer patients here? So we're working all together to be able to bring that to the U.S. Virgin Islands. The next program I want to talk about is our ACS CAN, or Cancer Action Network. Right now, number one on their radar is Medicaid in the territories, making sure that that funding happens in 2027. And so we worked together in 2022 to be able to educate lawmakers on the importance of Medicaid in the U.S. Virgin Islands, the unique challenges you all face with storms that come through and that sort of thing. And so we're doing that again and working closely with Puerto Rico, USVI, Guam, the territories. And last but not least, feel free to connect with us on Facebook. These are actually local Facebook groups where one is for St. Croix and one is for St. Thomas, St. John. And I post there monthly information, Cancer of the Month, screening information, detection information, and our local volunteers also post about the events and things that are going on. So we encourage you to join us. And that's it for me. Now I believe Cassandra is coming up from YAG Foundation, Ashley Gallagher. Thank you.
Well, good morning. You know, we always get a thrill at YAG Foundation when we can be in a room with all of you who share the vision and the mission of our late founder, Yvonne Ashley Gallagher, and our organization. And so, very happy to be with you today. We have one of our board members, Leslie Webb, with us. And of course, you know, the work of YAG Foundation is definitely to provide support services, mammograms, biopsies, but one of the really important parts of what we do is to provide awareness. And we feel it is really important that we provide individuals or empower them to be able to save lives through the information that they get. We decided that we wanted to start talking about the genetics of cancer, and we found that many families actually are experiencing breast and prostate cancer. And so we thought it was time to get that together, and we had the idea, and frankly, I think it was a great idea to have a breast and prostate cancer conference. And so we did that in April on St. Croix. And what we wanted to do today was just to show you some recaps, some highlights. And I think I heard there might be $50,000 or $100,000 over here. So if you think we want to bring it to St. Thomas, feel free to let us know. But we are going to bring up our video now, a short recap. Please enjoy it, and if you weren't there, you'll know what happened there. On April 24th and 25th, 2026, the Yvonne Ashley Gallagher Breast Cancer Foundation held its first breast and prostate cancer conference on St. Croix. Linked by genes, united by hope, 400 attendees participated from the Virgin Islands, the Caribbean, and the U.S. mainland. Opening remarks were made by the Honorable Commissioner of Health, Justa Encarnacion, the Honorable Governor of the Virgin Islands, Albert Bryan Jr., CEO of VI Hospitals, Darlene Baptiste, and Dr. Dante Galabert, husband of our late founder, Yvonne Ashley Galabert. During this short video, enjoy highlights from the presentations and get a preview of the full recorded sessions coming soon to the YAG Foundation's YouTube channel. Subscribe for free to receive notifications as new videos are posted. Conference Day 1 saw sessions in the Great Hall of the University of the Virgin Islands, which began with breast cancer survivor Dr. Lauren Bates, assistant professor at the University of South Florida, speaking to the conference theme, The Cancer Continuum, linked by genes rooted in community.
So then we're going to talk about the 4 pillars. And Miss Cassandra gave you a little preview of that. The 4 pillars of the cancer continuum are prevention, detection, treatment, and survivorship. We cannot talk about one without the other. So here's the diagnosis that's changed everything. We've got this cute picture on the front of the slide. Thank you, Ms. Dejanet. But I had surgery first, chemotherapy second, surgery again, radiation, endocrine therapy, which I still have, and I'm into survivorship now. I was a survivor on that day and several days before. In fact, this is, let's see, what month is this now? In April? 6 years and 1 month since my diagnosis.
Next, clinical psychologist Dr. Zena Peters came home to St. Croix from Houston, Texas, with valuable insights on the emotional impact of a cancer diagnosis.
You might notice some of these in yourself, right? If you're under heavy stress, you might experience headaches, feeling tired, or just really low energy. Sleep difficulties. Maybe you can't stay asleep, right? Your mind is constantly maybe on whatever is stressing you. You might notice digestion problems. Maybe you're noticing you're eating less or eating more, or maybe you just feel unsettled when you eat.
With 22 expert speakers, there was no shortage of great sessions. One popular time slot on day 1 featured Dr. Simeon Jaganoff's presentation on female and male breast cancer in the Great Hall, and Dr. Regina Flippin's medical marijuana demystified presentation in Classroom 102. Thankfully, all recordings will soon be on YAG Foundation's YouTube channel for all to see. On both conference days, Miranda Wood kept the audience energized with chair yoga, a great option for those who believe every great workout should come with a seat. With everyone feeling good, the Prevention and Early Detection panel was ready to discuss the first 2 pillars along the cancer continuum, with important calls to action to keep us healthy. Family medical physician, Dr. Jermaine Owen, fitness specialist, Dr. Kanuma Dubaya, and nutrition expert, Dr. Letitia Henry. Next in the UVI Great Hall, Dr. Wayne Thwaites, a board-certified urologist and surgeon based in Antigua, offered some powerful insights on prostate cancer in the Lesser Antilles. Over in Classroom 103, Dr. Erol Habdi, one of the VI's leading oncologists and hematologists, presented on triple-negative breast cancer, updates on genetic links and treatment, focusing on new developments in research, treatment, and the life-saving value of early detection. Conference Day 2, right after breakfast in the UVI Great Hall, we heard from keynote speaker Dr. Jay Jones, assistant professor at Emory University School of Medicine, on what every patient should know about breast cancer prevention and early detection, reminding all of us about the importance of being proactive about regular self-breast exams. This short video offers only a glimpse of the conference and could not include excerpts from every presenter. We sincerely appreciate the contributions of all of our presenters, including Dr. Bradley Cawthon, medical oncologist at Winship Cancer Institute at Emory in Atlanta, Georgia, presenting on prostate cancer along the cancer continuum. Dr. Jennifer Chang Wade, East Asian medicine practitioner, St. Croix, on complementary therapies for breast and prostate cancer. Tracy Sanders, RN and founder of Continuum Care and Continuum Care Hospice, St. Croix, presenting on advanced directives. Dr. Angelo Galabert, diagnostic radiologist, Imaging Center PC, breast and prostate cancer screening improves early detection. Dr. Wilfred Labiosa, Waves Ahead Corporation in Puerto Rico, the human side of cancer treatment decisions. Kavisha Watley, Program Manager, Cancer Control Program, VI Department of Health, representing the VI Cancer Coalition. And Pastor Christian Bruce, Where is Your Faith? All agreed that one of the top highlights of the two-day conference was the closing presentation of the Real People, Real Talk panel. Energetically sharing their inspiring personal journeys of survival were 6-year-old Sia Bates, Michelle Gibbs, Rena Sarow, and the Honorable Frankie Johnson.
My name is Senator Frankie Johnson. I'm a prostate cancer survivor.
Thank you to our major what's happening in our families and homes, and we need to do that. And so let's keep the conversation going. Yes, they used to call cancer the big C, but the big C is really communication. And so let's keep talking, and please take care of each other, and we'll try to help take care of you. Thank you.
Thank you so much, Cassandra. And now we are going to hear from Barb Michaud and Anna from Cancer Support VI.
So my name is Barbara, and I'm the Director of Cancer Support VI, and I'm here along with Anna Hawley, our Director of Operations. We're going to take a little different take, and we'll try to be really quick because we know we're last. But maybe they saved the best for last, I don't know. So, quickly, we're a nonprofit organization that raises awareness and funds, much like American Cancer Society, for those in the USVI impacted by cancer. This was started 21 years ago, and I have to acknowledge Charlene Kehoe, our director, who started the organization. We're just going to vary a little bit because you guys know what our mission is. You know what our vision is. I'm a heart-based person. I don't do math very well. Data is important, however. And I have to thank Kavisha and Linnea. I am sure I'm the bane of their existence, but it comes from a great deal of passion, like everyone else in this room, to make a difference. It's our motto. Individually, we are one drop. Together, we're an ocean. And if there's things that we can do to sort of break that stigma, just like CEO Baptiste said and the commissioner said, we go into places like heavy materials at 6:30 in the morning and we talk to 30 of those men who come up to you afterwards and say, wow, thank you, maybe I need to go get checked so that I'm not so afraid. So if this room continues to bridge that gap. I have to thank Cassandra Dunn and Denise, because back in 2019 and Yvonne got together and said, how do we bridge the gap for cancer care in the Virgin Islands? And to be standing in a room 4 years later, to be presenting a powerful 4-work group comprehensive cancer plan just leaves me in awe and gratitude. And to think that I have a lot of awe for the diagnostic and treatment group, because we are about to come aboard with a pilot program from a private donor. I know I'm segueing way off, but at the end of the day, there are our government leaders, which are huge, but it is not without our private sector. And I get very emotional because they are the ones who are putting $1 in the boot. They are the ones that are walking the field for Relay for Life and Ribbons for Cure, or the St. John Cancer Fund, who's not here, that does their walk. There are so many people that, and there are a lot of little small nonprofits that just want to make a difference. So I know it's about the funding, but we wouldn't be here if it wasn't for our private sector, and being able to go back out into the community and to confidently communicate to them what resources that are available here. Like, one of the things we wanted you to do is just to take 15 seconds and just close your eyes and imagine that cancer patient and imagine them getting that diagnosis, especially in the Virgin Islands, because they assume without a cancer center that there is no care, right? Where am I going to go? I have to go off island. I don't have family. I don't have friends. And I don't want anyone to know that I have cancer. So I'm going to ask you just to close your eyes and think of who that person might be. And I want you to think about when they make that call. I have had the privilege, and Anna has had the privilege since Annie Kerrigan, the patient advocate, left, for us to be that patient advocate. If I could tell you the calls that we receive and the overwhelming rug that feels pulled out when a cancer patient is first diagnosed, and the last thing they want to do is ask for money. They don't want to ask for help. They're embarrassed and they're ashamed. And Denise can well understand that every applicant that we serve, which on an average is anywhere about 350, that person, I lost my train of thought, but it'll come back to me. It's okay. I get very emotional and passionate. I apologize for that. But every person that comes in to apply, it's their name, it's that they're a Virgin Islands resident, and where do we send the money? Then we immediately send them to the American Cancer Society and say, here's an application. We aren't the only gig in town. We want to ensure that that cancer warrior is fully resourced. And we have to thank Governor Bryan, because 2 years ago, we were awarded over a year and a half, $1.2 million in a grant, in a federal ARPA grant. Thanks to that grant, we were able to upgrade what it is that we gave an uninsured cancer patient, which was $5,000 that year. If you were a MAP patient, you got $4,000. If you were an insured cancer patient, because they have copays, as well as Carla knows, a lot of costs come from being diagnosed with cancer. So kudos to the governor for allowing for a program like that to benefit a community such as ours. But we know that with the changes in the territory with Medicaid and with everything, even with funding, we have less people in the Virgin Islands. And oftentimes we are fundraising and we have this small pool. We can't solely rely on the funding that we do. We make a drop sort of in the bucket. So I kind of swayed from where I wanted to go, where we wanted to go in this, but Anna, I'll let you take it from here.
Barb. I'm Anna Hawley. I'm the Director of Operations for Cancer Support VI. This is my first Cancer Summit. Last year on St. Croix, we got rained out, so I wasn't able to participate last year. I'm really happy to be here. Number one, I want to bring a story to life of what Cancer Support VI does. We all have our own stories of somebody that has been diagnosed that needs help. But a real live example, I was sitting in the Houston airport over the weekend, delayed flights, trying to get back to St. Croix, and received a text from a friend of a friend of a friend who knew a little bit about what I did. They recommended that they reach out to me. This was a family member advocate who was advocating for somebody within their family who had just been diagnosed with cervical cancer, and they were an uninsured cancer patient. I immediately got out my laptop, emailed them the information, the application, the ACH form, and the physician verification form. They are in the process of returning that, and next week that uninsured cancer patient will receive $4,000 ACH'd into their bank account. So my point is, we talk about cancer doesn't wait. Cancer doesn't care about your zip code. They don't care what you do. They don't care how much money you make. Cancer Support VI, we want to make that quick. We want to make that process easy. We want to make sure that that money is in the cancer patient's hands so they can do what they need to do. Quick updates, because I know we're very short on time and it's going to be lunchtime. For CSVI in 2027, we're looking to expand programs that improve healthy lifestyles for cancer patients in the territory after they've been diagnosed. What can they do to continue to be healthy? What resources are available? As well as increasing awareness of the stigma that comes along with a cancer diagnosis. We need to change that stigma so that more people know to reach out to get help. And just like CEO Baptiste indicated earlier, getting into the communities, getting into the housing communities, the health fairs that Department of Health puts on have been hugely beneficial the past since I've been a part. I know they've been beneficial the entire time, but since I've been able to be a part of them. And the most recent one on St. Croix, 2 days later, we received an application for somebody who attended the Department of Health Fair on St. Croix. So we know that it's working. We know that everybody here is doing a good job, and I'm super proud to be a part of the organization and be a part of the summit today. So thank you.
And I just wanted to make one final to Sandra Charles and to the Diagnostic and Treatment Work Group. What a profound group of people to work with. We are meeting as part of this pilot program. Cancer Support VI has the privilege of a private donor. It's just going to show you how much our private sector wants to be a part of the solution for the reopening of CKCI. And it is an anonymous donor currently, but that anonymous donor and we are meeting with their board in 2 weeks. Please say extra prayers on Saturday morning, the 25th. And we're going to get that money. Thank you. And what that is going to provide is going to be a grant to support transportation from St. Croix and the lower and BVI's to CKCI. So we have partnered with Fly the Whale, Hampton by Hilton, and we're really hoping the Marriott, where they are providing an incredible rate for, and we also have a potential donor for someone to donate a vehicle to speak into what Linnea said, American Cancer Society said about transportation. So we do have someone that wants to make that donation. So it isn't always about the dollars, it's someone wanting to contribute to picking up that person. So huge kudos to that, because what a huge relief that will be for someone coming from St. Croix, where imagine if they have to spend 10 weeks for
radiation. And yes, we don't want them in a hotel, but part of this donor's desire is to do just what we're talking about and finding that plot of land, building that cancer center home where that person, Hope Lodge, similar to a Hope Lodge, but the cancer, with a Virgin Island twist on what does that home look like. And we've already begun that process of what kind of a campaign would that be. So we thank you for all the extra time and being able to share that. But lots of exciting things have come from 4 years ago, the CDC taking a risk in believing in cancer care in the Virgin Islands. So we have a lot of gratitude. Thank you.
Thank you, Barbara and Anna. So we are now going to pivot a little bit, but guess what? We're going to get gifts and food. So that's exciting. The Public Health Preparedness Program within the Department of Health, of course, what are we in? We are in hurricane season, and so we have a few questions here. We just wanted to ask to see how prepared we are, hurricane preparedness, and then we'll ask one question. Get your, who gets the answer right, you get a prize, and then we break to lunch. So question number 1 is, how many days of supplies should your emergency kit contain? Ooh, I want to be with you. Oh. I probably have 7 in mine.
Good morning. 7 to 10 days is the number that we all should be trying to stockpile.
Okay. And if maybe you don't have 7 to 10 days, according to the Public Health Preparedness Program, any other guesses? One more?
3 days.
Correct. At least 3. At least 3. But up to 6, and I love the 7 to 10 days because you just never know. But yes, it's at least 3, but up to 6. So you get the prize. Go ahead, Dr. Fredericks.
I'm just the deliverer of the prize.
She's just a deliverer. Wonderful.
And
Thank
it's
you
a
all.
$25 gas coupon
Oh,
to First Stop
that's
gas
a nice
station.
prize. Hopefully we will not need our emergency kits this year. I'm in Florida, so it comes to you guys first and it hits me. So, all right, wonderful. So lunch is ready. We're going to go ahead and break and come back here at 11:45. Thank you, guys. 12:45? Okay, sorry, 12:45. Thank you.